Welcome to Lesson 4. This lesson is divided into two parts, but overall, it concentrates on the interdisciplinary approaches for the management of Parkinson's disease. The contents of this lesson are as follows: first, an introduction. Second, multidisciplinary and interdisciplinary approaches will be discussed, followed by the case of Mr. Smith. The lesson will be concluded with a take-home message. First of all, some introductory facts. People with Parkinson's disease, abbreviated as PD, may experience several different symptoms, such as tremor, dribbling, fatigue, reduced balance, and psychological and social problems. As the disease progresses, taking care of people with Parkinson's disease and their individual needs becomes more complex. Patients will then come in contact with several different healthcare professionals, including but not limited to a neurologist, a psychologist and a physiotherapist. These professionals tend to primarily focus on the needs or symptoms belonging to their own expertise, rather than focusing on the person as a whole, through collaboration with other healthcare professionals. Thus, a holistic approach is lacking. This may lead to fragmentation of care. Stanger describes fragmentation of care as focusing and acting on the parts without adequately appreciating their relation to the evolving whole. In other words, the interplay between symptoms and needs of patients is not recognized. To improve care for patients with Parkinson's disease, a holistic approach is needed. This could be obtained by collaboration between healthcare professionals, through an interdisciplinary and multidisciplinary care approach. Within this lesson, we will use the Parkinson Net approach as an example for an interdisciplinary care approach. Parkinson Net was founded in the Netherlands in 2004 and has since expanded into a global network. The Parkinson Net approach focuses on the following three pillars: patient-centered care, network-based care, and collaboration with and between healthcare professionals and patients. We will now discuss the multidisciplinary and interdisciplinary approach. In multidisciplinary approaches, each individual team member approaches the patient from their own perspective. Usually, this approach involves a series of parallel, separate consultations, and the decisions made may or may not be integrated by a team leader. For this reason, the multidisciplinary approach is ideally followed by the interdisciplinary approach. Interdisciplinary care emerges from multidisciplinary care when healthcare professionals make group decisions about patient care, usually facilitated by face-to-face meetings. Thus, multidisciplinary and interdisciplinary approaches complement each other in delivering integrated care. Both approaches are needed for optimal integrated care. We can identify four conditions for an interdisciplinary approach: shared goals, effective communication, appropriate referrals to healthcare professionals, and shared contribution to treatment plans. In other words, healthcare professionals do not work in isolation from each other. While working from their own expertise, they recognize when their own expertise is limited, and when other healthcare professionals should be contacted or involved. By sharing a mutual goal, and being aware of the treatment plan of each individual patient, healthcare professionals are enabled to effectively work together and share expertise. Multidisciplinary and interdisciplinary care for people with Parkinson's disease is organized around and with the patient and their relatives. Several healthcare professionals are involved, and a specialized Parkinson nurse is usually assigned as care manager or case manager. Depending on the individual needs of the patient, healthcare professionals may include a neurologist, a general practitioner, a spiritual counselor, a social worker, a dietitian, a speech and language therapist, an occupational therapist, a psychologist and a psychiatrist. On this slide, there is a link to a video on patients' expectations of healthcare professionals. In the video, a patient calls for sensitivity and an understanding for varying needs per day. She illustrates this by the example of a chamber pot. Some days she is able to use it, and other days she is not. She also finds it important that each visiting healthcare professional is aware of her medication intake, and whether or not she has taken her medication that day, even if that is not their task. Because even then, this information is important. For example, her medication intake will affect her training at the physiotherapist as well. Let's discuss now the case of Mr. Smith. Within this lesson, the case of Mr. Smith is an example of Parkinson's disease care in practice. It provides examples of care needs of people with Parkinson's disease and their relatives. Furthermore, we will describe which healthcare professionals could be approached to meet the needs of the patient. In this case, the Parkinson nurse could be the single contact. However, this depends on the healthcare organization, the cultural background and the wishes of the person with Parkinson's disease. Mr. Smith is 79 years old, and he was diagnosed with Parkinson's disease 12 years ago when the general practitioner referred Mr. Smith to the neurologist. Mr. Smith has been married for 45 years with Mrs. Smith, who is 76 years old, and together they have 3 children and 4 grandchildren. Mr. Smith is familiar with back problems, and 15 years ago he had surgery for this problem. He is suffering from a generalized anxiety disorder and he is experiencing mood swings. In the past, he faced a depression. Until his retirement, he worked as a geography teacher at a secondary school. Together with his wife, he is living in an apartment on the ground floor without any adjustments. Mrs. Smith supports her husband as much as possible, but she is also having physical problems as a result of a cerebrovascular accident in the past. Every day the home care is helping them with activities of their daily living. Mr. Smith really likes listening to classical music, and he loves cooking. Recently, his speech has become a bit softer, especially when he is tired. He is suffering from freezing and increased response fluctuations. Rest tremor is moderately present, more on the right than on the left, and in daily life he uses a walker. He has a lot of pain in the back and legs both during the day and at night. Mrs. Smith indicates that her husband is struggling to maintain the storyline of what he is telling. Sometimes, when he is halfway through his stories, he has forgotten what he wanted to say. The condition of Mr. Smith is slowly getting worse. It is unclear whether this has to do with his cognitive functioning, mood problems, or whether apathy occurs. Mrs. Smith indicates that her husband is not doing a lot during the day and that he is constantly tired. He experiences a lot of tension when he has to go somewhere. During a consultation hour with the Parkinson's disease nurse, the most important problems for Mr. Smith and his wife were discussed. Firstly, pain complaints. Secondly, cognitive problems, this was in particular a question of his wife. And thirdly, fatigue. Within the case of Mr. Smith, the Parkinson's disease nurse is the care manager and she has a key role in supporting the patient and family, respectively caregivers, in their needs, providing the right knowledge, performing nursing technical interventions, multidisciplinary collaboration with other healthcare professionals, being a single contact point for multidisciplinary team approaches, and finally, coordination of care. However, there are differences in the role of the Parkinson's disease nurse in countries. It is important to keep in mind that the role and functions of the nurse can change between countries and institutions. After the visit to the Parkinson's disease nurse, she referred Mr. Smith to the neurologist. During the neurological anamnesis, Mr. Smith and his wife tell the neurologist about his pain complaints. He tells her that the pain in his foot is only in the right foot in the morning and is hindering mobilization. Furthermore, his back problems arise when he starts to walk, and the pain sometimes radiates to his legs. In recent years he started to increasingly lean forward. Whenever he is sitting down, the pain slowly fades away. The neurological examination of the neurologist shows moderate Parkinsonism. Neurologists are specialized in the diagnosis and treatment of diseases of the nervous system, such as Parkinson's disease. Neurologists usually diagnose Parkinson's disease based on the patient's story and observations during a physical examination. Ideally, the neurologist collaborates with other healthcare professionals and refers patients to other healthcare professionals when necessary. Next to the neurologist, several healthcare professionals can be involved in the care for people with Parkinson's disease. For example, a nurse, who provides information about pain and other symptoms, and the occupational therapist, physiotherapist and psychologist. All these professionals can deliver interventions to minimize the effects of symptoms by providing support in maintaining functioning, well-being and participation in society. Their involvement should therefore be considered. In the case of Mr. Smith, the physiotherapist could give advice on the posture of Mr. Smith. And with regard to his pain, involving a pain team should be considered in case his pain progresses. A pain team is a specialist option when complex pain problems arises. Furthermore, a spiritual counselor might also help alleviate the effects of pain through spiritual advice for Mr. Smith. Mr. Smith is familiar with anxiety, mood complaints and fatigue. These factors can influence his cognitive functioning. In the past few weeks, he suffered from hallucinations. His wife contacted the Parkinson's disease nurse. The Parkinson's disease nurse discussed the symptoms and actions with the neurologists. The neurologists advised the Parkinson's disease nurse to contact the psychiatrist for these problems. The neurologist may refer Mr. Smith to a psychiatrist when she feels that her own expertise is limited, has insufficient experience with the problem, or when the first-choice treatment is not showing the desired effect. Indications for referral to a psychiatrist are apathy or loss of initiatives, behavioral problems, delirium, depression, psychosis such as hallucinations, fear and panic, dementia, impulse control disorders, and finally, sleep disorders as a result of neuropsychiatric problems. Other healthcare professionals that are involved in the management of hallucinations are the general practitioner or neurologist, and one or multiple nurses. All healthcare professionals ask questions about the hallucinations, for example the frequency and when they occur, and all healthcare professionals are to reassure the patients. The general practitioner and neurologist discuss possible side effects of prescribed medical treatment. Nurses may assist the patient in identifying environmental stimuli that trigger hallucinations, such as plants and lamps. They also ensure good lighting in the patient's home during the day and evening. During a multidisciplinary team meeting, the Parkinson's disease nurse indicates that Mr. Smith's activities of daily living are getting more and more difficult. Sitting in a chair takes a lot of energy, and his rigidity is increasing. Consequently, 2 home care nurses need to take care of him in the morning. Walking takes away his energy for other activities, such as eating, drinking and talking. Furthermore, Mr. Smith is very tired and is sleeping a lot during the day. In response to the multidisciplinary team meeting, the team decided to contact the occupational therapist. Here follows information about the occupational therapist. An occupational therapist helps to improve the daily actions of a patient such as dressing, writing, eating, going to the supermarket, cycling, driving or practicing hobbies. Occupational therapy can also support patients when suffering from fatigue or mental changes that affect important activities in the patient's life. The wishes, experiences and questions patients and relatives have are central in the guidance. The starting point of the treatment is to make use of existing possibilities. For example, the occupational therapist advises how to adjust the schedule of a day. Furthermore, they can provide strategy training or they provide support in the request of resources. There are several indications for referral to an occupational therapist. Examples are, people experience difficulties in the following areas: living and or caring, work, and leisure. Another indication is when the caregiver is experiencing problems in the support of their loved ones during daily activities. Finally, Other healthcare professionals may have questions about the safety and self-reliance of the patient. In the video shown on the slide, a patient talks about her experience with the occupational therapist. They helped her plan her day after she quit her job, following the progression of her disease. The occupational therapist also helped her set boundaries in her daily activities. We continue with the burden of Mr. Smith's caregiver, his wife. During the nights, Mrs. Smith needs to help her husband going to the toilet for at least 4 times a night. As soon as he arrives in the bathroom, Mr. Smith sometimes feels that his urge has disappeared. This has been frustrating for Mrs. Smith. Mrs. Smith experiences many difficulties in taking care of her husband, but she prefers to keep him home as long as possible, as she promised him that. After a good conversation between the Parkinson's disease nurse, the general practitioner, and their children, they decided that it would be better for Mr. Smith to move into a nursing home. It is extremely important to give the patient and the family caregivers the right information about Parkinson's disease in the palliative phase. Research showed that family caregivers struggled with taking care of their loved ones and were unfamiliar with the term palliative care. The high care burden of the caregivers is having a big impact on their lives. Family caregivers may experience poorer health as a result of taking care of their loved ones. Additionally, they report feelings of psychological and social isolation and a decrease in financial income. Furthermore, family caregivers reported a lack of support from their healthcare professionals in this stage of the disease. The link in the slide will take you to a video of a caregiver who is sharing her experiences. She explains that most care cannot be done by other people, most of the care rests on her shoulders. She is also taking over her spouse's household duties, such as doing the administration. Additionally, she finds it exhausting to have to keep an eye on her spouse throughout the day. She has found respite in her spouse going to a daycare center for a few days a week, however, her spouse does not like going there. She then felt that she needed to communicate clear boundaries to him, to make him realize how his disease affected her as well. Another significant player in the care for patients with Parkinson's disease is the social worker. A social worker offers support to the patient and their caregiver on how to cope with the disease and its effects on psychological and social aspects. Psychological aspects include emotional problems, acceptation of the disease, and social life problems. Social aspects include work and leisure-related issues, financial issues, and support in laws and regulations. All healthcare professionals should be able to notice caregiver burden. As a professional, they need to be alert to signals from patients and their family or informal caregivers, in their willingness to discuss palliative care. Additionally, they should not overestimate the stigma of talking about death. Moreover, they are to provide the patient and family or caregiver with tailored information. Finally, healthcare professionals need to collaborate multidisciplinary. Some professionals are tasked with specific responsibilities. The Parkinson's disease nurse, for example, is responsible for the advanced care planning. The occupational therapist provides the caregiver with advice on how to schedule daily activities, and if needed, he gives advice on lifting techniques. Onto the case. Mr. Smith is admitted to the nursing home. Moving had a major impact on both Mr. and Mrs. Smith. Mr. Smith has to get used to his new environment, and this is making him restless, rebellious and easily irritated. Mrs. Smith finds this difficult to observe and deal with. She is unsure whether she made the right decision. In addition, she has to get used to the new life at home, alone. Mrs. Smith is experiencing anticipatory grief. The bereavement process may start before the patients with Parkinson's disease death, as caregivers grieve the loss to a nursing home or loss of their loved one's personality. After a multidisciplinary team meeting with the healthcare professionals in the nursing home, the team decided to refer Mr. Smith to a physiotherapist. The physiotherapist observed the on and off moments that Mr. Smith experienced. Essential goals for the physiotherapist in the treatment of Mr. Smith are to maintain his condition and muscle strength, and to control safety and independence in making transfers and walking with his walker. In the palliative phase, it is important that the patient is still able to execute meaningful actions, such as activities of daily living and transfers, instead of working on improvement goals. The focus in this phase is on optimizing comfort. A physiotherapist supports in improving balance, posture, physical condition, walking and transfers. Balance, posture and condition are usually treated with a movement program in which the physiotherapist stimulates to practice this in the patient's environment. They train walking and making transfers by consciously performing the movements. The rigidity problems of Mr. Smith are increasing, and he is getting more and more restless. It is clear that he is experiencing discomfort, and that he is in the terminal phase of Parkinson's disease. His doctor has tried whatever possible to relieve these symptoms, but they are not manageable anymore. In a conversation with the family, the geriatrician and the multidisciplinary team from the nursing home, all involved, agreed that for the reason of comfort no other options are possible than to start palliative sedation. By now, you have learned about the multidisciplinary care approach, followed by the example of Mr. Smith. We will conclude this part with a take-home message. In the care for people with Parkinson's disease, healthcare professionals should be aware of the expertise of other professionals, and contact them when their own experience is limited. Thus, the individual needs of the patient and caregiver should be the starting point in their care. This is the end of part 1. In part 2, there will be another informative case study.